Morning Barbados, good morning. Wake up, wake up, wake up. Morning to you.
Welcome back. It's time to get under my skin, or under your skin in this case.
Are we?
Under your skin in this case. We've got our friendly doctor, of course, Dr. Andrew Forde, and we're going to be talking about acral lentiginous melanoma. I think I got that correct. Did I, Dr. Forde?
Yeah, very good. You have a knack for that.
It's
Good morning.
easier when you practice first.
Yes,
Yeah.
and I had some practice. So, but simply put, this is melanoma of the hands and feet. Are we talking about palms or the entire length and breadth of the hands and feet?
Okay, yes. This type of melanoma predominantly affects the palms and the soles, but it can also occur under the nails.
Okay.
It's of great importance because melanoma is a cancer which is a very serious and dangerous cancer. It can affect both men and women, but it is more common in darker skin types. But also, in addition to being a melanoma that can manifest itself as color, there are also cases where there's no color in it and it's just a red area, so that's called an amelanotic melanoma, which is very difficult, more difficult to diagnose. It can occur either just by itself, or it can occur due to, from a mole that's there already. You'll be seeing pictures of them on the screen. So this one shows you just a discoloration, under the sole.
Does
you see
that hurt at
No, it
that
doesn't hurt
stage?
at all. The center
Wow.
has a much darker color, but you see this whirl of a dark patch that's at the
Yeah.
top, and it has an irregular shape, and also at the bottom. So it starts as a very subtle looking discoloration, and then you notice the changes in it after.
This is
So
why you really have to be inspecting your feet.
yes,
Our
most people never look
podiatrist
at the
kept
bottom of
saying
their
that.
feet. This is why it takes so long for the diagnosis to be made. It's if it's on the foot rather than on the hands.
This one
so
is
this one
scary.
looks a bit more irregular. You can see that dark pigmentation, but the shape is very irregular, and that's one of the things that makes you suspicious about it. It doesn't look like a regular mole, like a regular mole.
It looks a bit crusty. Does it take a crusty texture, like, for example, a callus?
Well, when it's developed more, it thickens, and when the melanoma thickens, then it's much more dangerous. This one, again, very dark color, but you see a rim of thickening around it as well.
So, Doc, how does one not just, oh my, hope you didn't have coffee as yet.
Yeah.
How does one actually not mistake that for, I got a callus, the shoes burning my feet, or causing, how can you not
How can you
mistake
distinguish it?
Yes, how can
Well,
you
well, the
distinguish
important thing is that you should get to know your feet over a number of years. It's something that occurs with increasing age. So most people who get it are 40 and over, unless you happen to be really unlucky to get it earlier. So if you get to know your feet, you will know on your hands. You'd get to know any changes that occur, but there are some rules that help you to distinguish it from normal things like moles, and that's called the ABCDE of melanoma. And A stands for asymmetry, and asymmetry really refers to the inability to draw a line through the lesion, which cuts it in half in shape and in size. So if you can't draw a line through it and it looks the same on either side, then you should be suspicious. The B refers to border irregularity, where the edges are scalloped and they're finger-like projections, and just it looks disorderly, and that's something to look for. C is color variability. You will have noticed that in all those pictures, or in most of the pictures, there were varying types of darkening there, and there was a very dark area, lighter area. You couldn't get any order to it. And the E is evolution. That means in size and shape, and in color. And I did leave out D, which is diameter. And usually the diameter is greater than the size of the top of a pencil, the rubber on a pencil. So that's just maybe 6 millimeters or so. So if you see something on your skin that looks disorderly and wasn't there, it's not something you can remember having all the time, then you should have it looked at. But most people think the thing that causes a lot of confusion is trauma, because if you get a trauma on the nail or on the foot, you get a darkening. So that's something to
Can
consider.
that be fatal?
Yeah, certainly a melanoma can be fatal, and it has to do with how much it's developed. That stage where it's just flat and has a lot of discoloration and variability in color.
Which was the first pic you showed.
That one that's what's called in situ. So it means it's just in the upper layer of the skin. It hasn't spread, and once you can get that removed, you are certainly cured. They're not dangerous once you get them at that stage. But once it starts thickening, then it's a matter of how far it's invaded, and how well you do depends on how far that invasion is. So if the thickness is less than 0.75 of a millimeter, then usually it's cured very well. But between 0.75 to 1 millimeter, then there's a 5% chance that you can get a recurrence. But as it gets thicker, let's say like 4 millimeters or beyond, then your chances are maybe 50% for a 10-year survival. So it's important to pick it up early.
This acral lentiginous melanoma sounds and looks very scary.
Yes, it is scary, and something that's very important to diagnose. This is what happened to Bob Marley, and why we don't have him with us today. He would have had a lesion on the foot and would have thought from all the football it was some sort of traumatic lesion, would have left it and not paid attention to it. And once the horse gets out of the barn, it's difficult to have it sorted out. That's why I thought it was important enough to bring it to the attention of our viewers today.
I want to talk a little bit more about that when we come back, because Bajans have a tendency of saying, you know, if nothing wrong with it, left it. So we want to come back and talk a little bit more on lentiginous melanoma right here on Mornin Barbados.
Morning Barbados, good morning. Wake up, wake up, wake up. Morning to you.
25 minutes before 7 o'clock. I'm just going to repeat for those who might have just joined us. Today, getting into my skin, we're talking about acral lentiginous melanoma, and we would have seen, yes, some rather graphic photos of advanced melanoma on the soles of the feet particularly. But Dr. Forde, the old people used to say, if it ain't troubling you, don't trouble it. Does this melanoma actually trouble you? Do you feel any discomfort from it? Is it something that can actually cause you to be alarmed at an early stage so that you can deal with it?
It's usually painless, so that advice is only good in some situations. But this is one where it's always important with your body that if you notice a change in any way, that you have a consultation with your family doctor and have it looked at. Because not all cancers usually don't hurt. You only get pain when a cancer is spread and is affecting other parts of the body or organs. So definitely that's not advice that I would give to people when it comes to this.
How does it become fatal? Does it work like any average cancer would?
Yes, the cells, these are pigmented cells, the melanocytes, and the important thing is that the months or years that it's just spreading and looking like a mole or a freckle, it's fine. But once it starts to thicken, then the cells are moving into the body. So cells can be spread through the bloodstream. They can be spread through the lymph nodes. And this is a very important part of the monitoring and staging of the disease. And of course, once you have a cancer, trying to decide how far it's gone determines what your prognosis or your chances are. So the lymph nodes are the places where it would go to next. So the lymph node that's responsible for that's a little swelling in the body where all the cells that fight infection and foreign invaders would reside, and that causes a swelling, and then it can go to other places, other organs. So you can have a melanoma in the foot, end up and be diagnosed initially with a lesion in your liver or in the lungs or in the brain or some other place. So like any other cancer, early intervention is very important. I also mentioned under the nail, and we saw that graphic picture, which I have to apologize for in retrospect. But the thing is that you can get initially that color coming from under the skin that produces the nail. So that's from the nail matrix, and initially it starts with a line through the nail that gets bigger, a linear line.
Is
and
it
then
dark?
the color, yes, well, darker lines. And then the color just moves to the skin just around the nail, which is called Hutchinson's sign. But there are cases where people normally have pigment in their nails. So it's, if you have like 10 nails and all 10 of them have lines, then that's just physiological. But a change is what you're really looking at, any change that occurs.
Sounds to me like every day, each of us really should sit in front of a mirror and inspect ourselves.
Yes, definitely. Especially if you're diabetic, you should be aware of your skin and changes. And this is very important for individuals of lighter skin color. We talked about the skin types, and those that are more Caucasian, you have to be more aware. But for us of color, we too have responsibilities
Sure.
and have to look. We're not indestructible. We all have our specific situations. As I said, this melanoma only occurs maybe in 1% of Caucasians, while in the darker skin types it may be 30 to 70% of an occurrence. So this is the melanoma. We usually hear about melanoma and say, well, I'm darker, I don't get sunburnt, but this one has nothing to do with the sun, and the actual cause of it isn't known.
Okay. Does it present in the same way on the hands? Because you mentioned that it's of the hands and feet.
Yes, but the feet, having it on the feet is so much more common, but on the hands too, it would be a similar thing, a discoloration, a darkening.
And it would happen on that area?
Yes, it would happen on the palms.
Right. Okay.
That's the main thing.
All right. What else can you tell us about this lentiginous melanoma? How if this happens, how do you have to have then weekly treatments?
Well, what happens is that you need to confirm the diagnosis. If it's small enough, the doctor will cut the whole thing out and get it tested under a microscope. And the level of it and the thickness will be determined by the pathologist, as well as how the cells look, how disorderly the cells look. Sometimes it's so big that you just have to take a little piece of it out, in which case the doctor may take many little pieces out just to have them all checked, because you can sometimes miss the focus of the melanoma if you just take the wrong sample. But the main treatment is excision and a wide excision, and as I said, if it's just in the surface, that will cure you. After that, you get followed up with checking the lymph nodes. Sometimes the doctors will take what's called a sentinel node, which is the first node that that melanoma would spread to, and check that. But you can be followed up with examinations monthly. You can get MRIs, CAT scans, scans called PET scans. The treatments, other than surgical and sometimes you can get amputations if it's a digit. You can also have radiotherapy, and there are lots of advances in chemotherapy for melanoma which are being tried out. Some of them affect the immune system. Some of them work in different ways to try to stop the melanoma.
This has got to be way more complicated for someone who is diabetic.
Yes, certainly. Diabetics get a lot of problems with their feet. And there are other types of cancers that you can get since they get ulceration that can result in squamous cell cancers. But you can also have a melanoma that ulcerates. And when you get a thickening on ulceration, then the prognosis is a lot worse, because it means it's developed much more than just the plain one that we saw initially, the in situ stage, where it's just the surface and building up to something that can invade.
You mentioned earlier the age bracket that this form of melanoma is most common in.
Yes, that's as we get older, 40 and above. The older we become, the more susceptible we are to changes, because our immune system is always working to get rid of these abnormal cells. And sometimes cells can kill themselves. That's a way of getting rid of these things. Or you have cells like T cells and other cells that can get rid of them. And also the body tends to try to get rid of bad cells through enzymes and bad things in the body. So your immune system is working, but sometimes it can become overrun with time and with aging and other factors as well.
I don't recall whether we discussed if it's genetic or environmental.
Well, the actual cause isn't known, but maybe your genetics could have something to do with it, because the darker skin types suggest that certain parts of the genome that are, specific to us make us more susceptible.
Okay,
than
so the
lighter
more
skin
melanin
types.
in the skin, the more likely you are to
Well,
get
for
it?
this specific type, yes, but for the other types that occur on the body, then it has to do with sun damage, recurrent severe sunburns, or just being of a skin type that tends to burn and being in exposure to lots of sunlight. So the other types of melanoma usually occur on parts of the body and on the limbs, on the face, or on the trunk. There is a type that occurs on the face in a much older age group that is also called lentiginous melanoma, that looks just like a freckle or a dark mark and then starts to thicken, and that occurs in a much older age group. So we all have, the varieties are determined by your skin type and your age as well.
My goodness, the things that are out there.
Yes, but at least many people don't get melanoma, so, but it's still important to be aware of it. In places like Australia and in lots of first world countries, melanoma is something that they do a lot of educating about, and they're very big on sun prevention and sunburn prevention and taking care of the skin and monitoring the skin. And almost everyone from the time they're in primary school knows about the ABCDE rule, and they are aware of it, able to apply it, and more aware to get checked by their doctor. It has to do with education and awareness. And if we as a population can be more aware and educated, I think we'll be a much healthier place. But it's rare, but it's still necessary to know about these things that are rare.
And we appreciate your sharing it. Just to go back quickly to what you said about the incision, it's usually taken out if it's early enough. If that person is diabetic, then is there special care that is required for the healing process?
Well, depending on how large it is, you may need to have a skin graft. The excision is deep. You go down to the fat, and also you go in the early stage just 5 millimeters. And if it's too large, then you may put some skin there, or you might just let it heal by secondary intention and form a scar. But the care and making sure that it heals, you get antibiotics and dressings and stuff to make sure that that heals. And your doctor / surgeon / dermatologist, it may be a multidisciplinary monitoring that goes on.
Thank you, Dr. Andrew Forde, very much for sharing with us everything that you did this morning on acral lentiginous melanoma. Serious situation, but certainly we're educating you, so we hope that you found it informative. We will be back. You're going to meet a young scientist. That's what I'm calling her. She's an inventor, and she's got an app that was inspired by her personal experience. We'll be right back, and you'll get the opportunity to meet Zachy